I was experiencing some difficulty with some pain in my tooth. It was just a feeling, but it wasn't really painful, but it was just, I knew it was there.
When you look at the x-rays in Jean's case, it looks pretty standard. Silver filling, not a lot of gross decay or anything along those lines. Constantly we have to monitor and test and diagnose exactly what's going on because symptoms are coming from somewhere. And x-rays are two-dimensional and only one of the tests of many different tests that we use to determine whether a tooth is infected and needing a root canal.
I'd never had a root canal before and I was, a little nervous about it. So he explained to me about IV sedation and I decided that that was probably a really viable option for me.
Some people just require the local anesthetic. Some require the gas, some want oral sedation, and some want IV sedation. We tailor the sedation, whatever it might be, to that person's needs. One of the benefits in this office, was she never felt the injections in her mouth. She never felt claustrophobic under the rubber dam, and it allows us to do that more thoroughly as well as protect the airway.
When I was given the IV, I did feel the initial prick, and that was the only thing that I felt from then on.
Working under the microscope, once we removed the silver filling, we found a crack, and there was a slight vertical crack in her tooth that did not show up on the x-ray. So using the microscope, you can see down the root canal system many times to the tip of the root internally. It's almost as if you're inside the tooth walking around. And without that, you don't have that benefit. It's a guess.
The procedure was completed, and afterwards I was awake. I was aware of what was going on around me. I was wheeled in the wheelchair into a privacy elevator towards the back of the office and taken downstairs. And my husband was in the car waiting for me, and I was helped into the car and we went home.